Hello, everyone. I am Dr. Tawab, co-chair of ISPRM Communications Committee, and it is that time of the year when we announce the Sydney Licht lecture of ISPRM 2026 Congress, which is, you can say, by far the most important lecture that is going to be over there. So this year's the topic is going to be about understanding rehabilitation in public health emergencies, and Dr. Colleen O'Connell is going to be delivering this lecture. And we have today, she has joined us today. So, how are you, Dr. Colleen?
Good, good. No pressure though at all, right?
No pressure, but we all are very excited to hear your thoughts on this very important uh, topic. So, let's just get to it, right? So, in the recent public emergencies, so where do you see that rehabilitation fitting with the traditional emergency response framework?
Well, I think rehabilitation needs to sort of break the mold of traditional emergency frameworks that typically in the past have seen rehabilitation coming in as an add on or a luxury or an optional intervention. Rehabilitation is essential in any type of public health emergency and really should be integrated right from the get go of the preparedness all the way through the response, recovery, and resilience activities.
And from your own experience, so what do you think are the most critical early rehabilitation interventions that can significantly alter the long-term functional outcomes during the crisis?
I think if we're thinking about a sudden onset emergency like a disaster such as an earthquake or conflict, rehabilitation has a critical role to play in preventing the secondary conditions that can occur both from people who have suffered new injuries or persons with disability who are affected by an emergency or a disaster. Prevention of secondary health conditions and maintenance of skin, bowel, bladder are hugely important and allow people to maintain their health and return to communities.
So, can you share a real world example where timely rehabilitation actually made a measurable difference during a disaster or an outbreak?
Absolutely. I think one of the best examples that we're all probably familiar with is Nepal. And Nepal knows that they are in an earthquake prone area. And the rehabilitation center, the Spinal Injuries Rehabilitation Center, actually anticipated there could be future earthquakes and prepared their staff, prepared their community for what to happen. They had contingency plans to how to manage a surge. And they did all these exercises a few years before. In 2015, there was, in fact, an earthquake. And they were able to very smoothly move into expanding their services, putting in their contingency plans, and were able to very quickly provide the rehabilitation services acutely and longer term for all the increased numbers of persons who needed rehabilitation. And that model really serves as an example for us in other countries of how we can work in terms of our prevention and preparedness for health emergencies.
So, I think that's a very great example, and I must say, we all are very excited for your lecture in ISPRM 2026. See you there in a month's time.
Thank you.
Thank you so much for joining us today.
Thanks.